I have no financial disclosure because as far as the scientific fraud is concerned, it includes the plagiarism, the fabrication, the falsification, it includes everything. So most of these, this has been already. So we already, I think, talked about this part that this is unrelated publication and introducing it in new publication. These things were already, so I'm not going to. So the problem with the scientific fraud is that there is intentional fabrication of data. One of the problem is because of this publish and perish kind of a concept in many institutions that you wouldn't get a job, you wouldn't get promoted, so you get motivated, and that's how you land up into your application. And also there is a problem at this time. You want to benefit the product or the organization because there is some other involvement. And the scientific fraud also include you would do that. So we talked about some of these things that you never actually saw the patient reported in his clinical studies. This also happens. And failed to get an ethical review board approval for his research and published by producing false approval. Perform the test recorded as complete. I think this has happened many times. You report that you have done ERG for all the infants, and you have done for 100 and some infants. How do you do ERG? I mean, it's not an easy procedure. You require probably anesthesia, but you have done for all. And then you're talking about that and publishing everywhere. And fudging numbers. I think this is the biggest problem for us. I think we multiply all the numbers. That is, the multiplication is so common. And falsely claiming to have found evidence because we saw, okay, Avastin works for whatever, say ROP, which is my subject, and then you say that it worked for everybody. And all the 80, 85 patients who saw, it regressed the disease and all, and nothing happened. And which is not true, and subsequently that is what happens. Then the deliberate suppression of data in a finding, and this would happen very often, and only you tend to publish the benefit of the treatment. So rest you will not even. And the biggest problem is omitting the harmful side effects. And this is what is a serious issue, in fact. And there has been so many, I came across once I was looking at literature, that people have made millions, sometimes billions, before such drugs or other things were withdrawn just because of the publication. And of course people subsequently lost their jobs and other things. And failure to publish, even if the result demonstrates harm of a drug, that is also a problem. So what is motivation for a scientific fraud? You want a quick fame and a fortune, and money may be the main goal in life, and management is influenced by the revenue. And so there is a tendency to indulge in all the things that I talked earlier. So if once the scientific fraud is exposed, what should be done? Shamed, you feel shamed in your scientific community, provided that something has been done about it. And all awards and prizes may be withdrawn. I think it hardly happens. At least it doesn't happen in our country. And if it is serious, it should be struck off the medical register. It happens in so many countries. And it would cast definitely shadow over the entire past research work, that may be lifelong work, because that means his intention has been like that. He has always been fabricating and doing stuff like that. And PhDs may be really retracted. That has been done in many countries. But as I already said, only minority of culprits get sacked. They may have just, so it depends. Now, this is a little bit of an issue here, solo practitioner fraud. I think private solo practitioner may inflate or falsify the data. And there is no institution can sort of investigate these allegations. And it can be difficult to approve or disapprove this kind of misconduct. And he can always insist that he's innocent. There's no way. You can't do a thing about it because you don't have that kind of a mandate to go and check everything. And this would happen. And I think Mr. Gupta already said, credibility is added once you have multiple authors from multiple places. Obviously, then probably somebody is going to really come out if something has been done like that. So every institution that conducts research needs a system to provide leadership on preventing, recognizing, investigating, correcting, and publishing wrongdoing in science. And some of the things which Mr. Gupta in our department, he tries all the time, that every project, everything, we should be discussing in a committee, and it should be, and everybody should be present there. If there is a little bit of a conflict, or there is some issue involved, whether it is regarding patients or, it should be discussed and brought there. So right in the beginning, rather than in the end, you have an issue. And then all those projects, or even the smallest thing today, if you write a case report, it has to go to ethics committee. And many a times, that is what we have seen. It has not gone to ethics, but you have written that it has been approved by ethics committee. That is where the problem happens. So I think this policy of publish or perish needs to be changed. And so I think scientific fraud generally is hard to catch, because you need to examine the records. You need a couple of people in the labs for laying traps and keeping records, because you will have to, if the person is like that, you will have to do that. And maybe random spot checks apply. And if there is a whistleblower and you feel that he has really exposed, I think we need some kind of protection for that. It is there in many countries, but then that is a problem. And what is the punishment? One is, of course, a withdrawal of a research grant. And the grant for attending the meetings, the presenting work need to be stopped. I think we need to have some kind of a, and strip the person of a job if the crime is serious. As some of the biggest people have lost their jobs, and because they benefited the companies for billions of dollars once you go in stem cell research, in so many other things where they claim, and then these procedures started, were done. So as far as in our country is concerned, I mean, I already talked about that. There is this kind of a problem that you did not perform the test, recorded that it is complete, and this is not uncommon. Multiplying is also common, and false claims to form evidence, and publishing the same article in different journals. This has happened. This has happened even with the Indian Journal and other, and some few were named also and put on the Indian Journal. And publishing the figures and pictures from books or presentation of others. I mean, you put a figure and you put in the next article, that very picture is there. So that has happened with us also. I mean, our picture being put in the journal, even in journal. And they were, so there is an intentional suppression of the sort of a results. So most scientific frauds in our country are overlooked. Even if something is pointed out, and very strictly, I think we'll have somebody at an important position, he's going to come up for the protection. So there's a problem. So there's hardly any punishment about it. And fabrication and manipulated data is not uncommon. That's why probably most people don't trust us, and we have to come out of it. We need to have a more effective ethics committee, which is very, very important. And so I think we can go on and on, but I think there are lot many issues which need to be addressed as far as the scientific fraud, especially in our relation or in our country is concerned.
Thank you, Mangat, and have a lovely